Okay, sometimes you're not a candidate for LASIK, but you can be a candidate for PRK, and we're going to be looking at some examples of this on Dr. Haverly's iPad, and it's Dr. Haverly from Laser Eye Surgery of Erie. Hello, doctor. How you doing?
Welcome. Thank you for coming.
Yeah, and
I'll explain PRK, or another word, as an abbreviation for photorefractive keratectomy. Some people also call it advanced surface ablation. Those are all synonymous names for the same procedure.
okay, and then, so how am I a candidate for PRK versus LASIK? How do you determine that?
We put you through a battery of tests, and patients usually do better with PRK if they have a thinner cornea or a very strong prescription. In addition, there's some eye diseases or eye conditions that you may be a better candidate for PRK over LASIK.
Okay, and then I also understand too, if you're in a profession like, say you're a boxer and you potentially could be getting hit in the face a lot, that PRK is better for you.
Yeah, some people feel that way, that if you're a mixed martial artist fighter or a boxer and you're hitting the eyes a lot, that PRK, there's no flap like you have with LASIK that could be dislodged or moved. And a lot of people feel more comfortable with the PRK surgery instead. And
the flap is really the key, correct? And I know you brought your iPad here to show us. I'm getting an angle here so that the lights don't interrupt people's vision. So I just did that right there. Let me just swing around. Okay, so we look at...
Well, the difference between LASIK and PRK is with PRK there is no flap. We remove the epithelium on the surface. Once that's removed, then the laser is performed as shown, with this diagram here, okay, with a laser. And once the laser is performed, then a contact lens is placed on the eye.
Okay, so instead of a flap, you're actually placing something on the eye, correct?
Sure. We place the contact lens on the eye, which acts like a protective flap to help it heal and recover quickly.
Okay, and then we're actually near the laser that you actually, because it's still a laser that you use for this, correct?
Yeah, with a PRK, you actually use the same laser that you do for LASIK.
Okay.
And we use the Vizx S4.
Okay, we've been here before. This is the one this is from our LASIK video.
Yes, exactly the same laser. Yeah, this is it. This is the laser that will perform the PRK. With LASIK, there is a second laser that creates the flap, but with the PRK, we can do it with the one laser.
And there's slightly more of a recovery time with the PRK?
Yes, the recovery is a little longer because there's a larger abrasion. And say, for example, if we do the PRK on Tuesday, we'll put a contact lens on the eye, and it will stay on usually until Friday or sometimes Monday to let that epithelium regrow and to allow the abrasion to heal so you can see better. With LASIK, there's a smaller abrasion, so the recovery is faster, and usually the patient doesn't feel it as much afterward. But actually, during the procedure, the patient really doesn't feel much of anything, during that. The eye is numb with drops. You'll see bright lights, maybe a strange smell, and usually the treatment takes less than 1 minute to do, and per eye, and then you're able to go home right after that.
Okay, Dr. Haverly, now, is there anything I haven't covered with PRK that you think is important for somebody considering the procedure to know?
Well, you have to make sure that the overall health of your eye is good, and there's no other underlying conditions that may cause problems.
And that's something you help people with, correct?
And we would do the evaluation here to make sure that everything else is normal and clear, and that it's safe to have surgery.
Okay, well, Dr. Haverly, Laser Eye Surgery of Erie, giving us the differences between PRK and LASIK, and I know you and your staff help people determine what's best for them.
Yes, thank you.